bariatric surgery, Ozempic, Mounjaro, and a lot of different types of weight loss methods we're going to talk about. Who is it for, when you should get it done, and why you should get it done. Join me, and I'm going to be talking with Dr. Neeraj Rayate, who's a noted bariatric surgery here in Pune. Stay tuned. Hello and welcome to Breathe India. This is a show where we talk about mind, nutrition, movement. I am Rita Date, your host. I'm a yoga and meditation coach, nutritionist, and I've authored 2 books on healthy eating. So if you want to cut through all the wellness clutter and get practical information, all backed by science, you've come to the right place. So welcome, Dr. Rayate. I had one episode with Dr. Rayate on general gastroenterologic issues, and that was a wonderful episode. You can find out in the link below for that episode. Today we're going to talk about bariatric surgery, which is one of his specialties. So for those people who don't know what it is, can you explain what bariatric surgery is?
Yeah, probably our focus will also have a lot of discussion about obesity and weight loss.
Yes.
Because bariatrics comes probably at the top of the pyramid. And if we see 10 patients, if we consult 10 patients for the weight loss, maybe 1 or 2 only need bariatric surgery. Bariatric surgery is the last step or a tool for those patients who cannot lose their weight or get rid of their different obesity related diseases by non-surgical methods. So we all know when it comes to weight loss, there is diet, there is exercise, there are medications which help in weight loss, or for that matter resolution of some diseases like diabetes, blood pressure, heart disease. But when somebody has reached to a stage in his life or her life where his weight is such that he is not able to lose significant amount of weight by these methods, the conventional methods, bariatric surgery definitely helps them in coming back to their original weight and living a good quality of life. And mind you, when we say surgery, it's not a big cut or a big surgery. It's done with the help of minimal access, either by laparoscopy or robotic. So patients are up and above the next day after surgery, and they get results in significantly in their life after the surgery. So yes, it's a boon for those who are not able to get effective results when it comes to their weight loss or comorbidities by conventional methods.
Okay. Like going back to obesity, why is it so hard to lose weight? I mean, do we have a set point, like where this is the weight we're going to be, so if we lose a few kgs, we're just going to go back to it, so what's the point? So is that true? Do we have a set point?
Yes, to a certain extent, definitely. But more than that, what we have to understand is human body. Human body is very intelligent. All of us who have practiced any kind of weight loss, we will all realize that if we try and do weight loss by the same method, we will not lose the same amount of weight next time. Have you seen that?
Yeah.
Like somebody who has done intermittent fasting and have achieved 10 kgs, if he stops that, he will have a bounce back where he will gain 20 kgs or 15 kgs. And then if he starts doing intermittent fasting again, he will not lose the same amount of weight. Somebody who is trying to do a particular type of method for the weight loss and has lost some kgs, but if he stops that, there is a bounce back which is double. So this happens basically because human body works on a phenomena called as economization. So the same amount of exercise, same amount of diet, same method for a particular therapy probably may not give us the same amount of result next time, because body tends to adapt to the kind of stress body is put into. That's why there is a principle when it comes to exercise, that if you are doing a 5 kg weight today, you have to progressively increase the weight. You have to challenge your body every now and then, so that then there will be some amount of improvement in your skills. Similarly, if you are trying to follow a particular kind of diet for weight loss, my recommendation always is try and follow a diet which you will be able to follow all your life, because This is not something you can stop. If you stop, your body is going to give it back in double.
Oh, I'm just, now I explains many things throughout my life now. I didn't realize that it won't work. I mean, I've seen it, but now I know the science behind it, that, why it doesn't work, and things come back. So what's the solution? Just like you said, keep a diet or a lifestyle that will take you through the life, right? That you don't have to go, so you're not bouncing. Is it dangerous to go back and forth, fluctuate in your weight?
Absolutely. If I have to tell you one word which is key for consistent weight loss or maintaining weight or healthy life, the one word is consistency.
Right.
And as human beings, probably when we try and relate ourselves to consistency, we tend to do it to 100%. Like if I am doing 6 days a week exercise, we feel that if I am not doing 6 days an exercise, I am not consistent. But this is not true. Consistency is the game where we restart our activity after it has stopped. So it is fine if there are some periods of lapses in between where you lose your diet or if you lose your exercise, but getting back to the routine is something which is key.
Right.
So if you do 4 days once, 4 days in a week once, then 6 days in a week, then 3 days in a week, that's still fine. Consistency is equal to 80%. It's not 100%. So we should try and focus on doing things to the 80% perfection, and that is still enough.
Okay.
The issue is that if we start doing something and if we stop doing something, we don't restart.
Right. We do 100% and then go down to 10% or something, right?
And then we say that, no, this is not for me. This is not my cup of tea. And that's where the issue starts. So if we do diet, if we do exercise, if we follow something with 80% consistency, that still in long run will have compounding effect. That still in long run will have sustainable results when it comes to outcome.
Okay, that's good advice. So BMI, body mass index. People are saying it's not the best indicator, and adding on to that, there's this whole body positivity movement happening. So I know it's a good thing, but I have my reservations about it because there has to be a balance. Yes, you should be positive about your body, but you have to have the healthy body. The extra weight, we've seen how many diseases it causes, and etc., etc. Can you be healthy and have a high BMI?
I'm little from the side of people who have higher weight. So I personally do not like people calling obese, because I have realized that in good amount of people, the excess weight they carry is not completely their fault. And as a human, we have a tendency. I come across a lot of patients in my consults where the family, parents, brother, they tend to blame the individual. They say that he is not following diet. They say that he is not doing exercise. She is doing this. And then we probably lose our focus. We have to understand that sometimes excess of fat, excess of weight is not completely a mistake of an individual. There is something happening in our body which is beyond control of that individual. And once we try and understand a trigger point for that individual, why it is happening, and work around that trigger point, we can definitely get excellent results.
Can you give an example?
We have 30-year-old girl who has come to us for weight loss consultation. Her weight is around 95 kgs. Her height is around 163 centimeter. So her BMI is in the range of 34 or 35. And when we investigate her, my first question to all these consultations is that what is your weight related challenge? Because one has to understand what exactly is the trigger point. And when we investigate, we realize that in this particular individual, the thyroid function is low. This person is gaining weight because of hypothyroidism. So what's the point in blaming that individual when the thyroid function is low? We will have to correct the thyroid function. You correct the thyroid function, you work on their normalization of thyroid, they can lose weight. If we investigate such individuals and on sonography, we find that they have a polycystic ovarian disease, which is a PCOD or...
Very common now, yes.
It's very common. Then PCOD is something which is the culprit, not the individual. So we keep on telling the patients, please don't blame yourself. This is the issue which we have to tackle. If we tackle this issue, you will be all right. It's a battle of your body with you, and you will have to win that battle.
But to tackle that issue, they tell you to lose weight.
That is very true.
Yeah.
That is very true. And yes, it is possible to lose weight. We will have to work. Again, the key here is consistency. If you want to lose weight, don't expect you losing weight in short period of time, because any weight loss which is of short duration has a very high chance of bounce back. We call it as cheating. If you really want to cheat your wet set point, the weight loss has to be gradual over a period of 9 months to 1 year. If you lose half a kg to 1 kg over a period of 9 months to 1 year, trust me, your weight loss will be sustainable and the chances of bounce back will go back to minimum.
Okay, that's good. I listened to that. Okay, don't do things slowly and follow this pattern. Don't lose weight too. If it's too sudden, too fast, it's not going to.
Absolutely. The key is sustainability. What we should focus on is what I can do to sustain this process of weight loss, because if you follow sustainability, you will definitely maintain your weight.
Okay, going back to the 30-year-old with thyroid problem, if she starts her thyroxine or something, is it normalized just by that medicine? Like, I found that it's still hard to lose weight after that, right?
So fundamentally, we have to understand that low thyroid is obesogenic. So when we normalize thyroid, we will also simultaneously start working on the process of reducing the fat mass and increasing the muscle mass. Low thyroid is directly proportional to low metabolic rate. So we will have to work on mechanisms by which the metabolic rate also needs to be increased. So we have to understand that if the body mass increases, the requirement of thyroid is going to go high. And that is why just treating hypothyroidism is not going to help. Correcting hypothyroidism and simultaneously working on diet and exercise will definitely help.
Okay. So you cannot blame your thyroid women. You're not anymore. You have to have other methods of...
So we have our patients who were morbidly obese because of their hypothyroidism, and we got them treated for bariatric surgery, and their thyroid functions have reversed. They have been off their thyroid medications or on minimum thyroid medications. So I don't think we should try and blame a particular disease. As a humans, we tend to find some or other kind of excuse to which we can cling on for the kind of non-performance or failures we face in the journey of weight loss. We will have to understand that this is a part and parcel of game. There can be some situations where we may not get expected results, because we have to understand what works for us, and then once we find that eureka moment, stick to it.
Okay, that's good to know. So going back to bariatric surgery, I know there's all different types of surgery. One is like a bypass, one is stomach stapling, they call it. Can you explain the different types for us?
Yes, absolutely. So commonly performed procedures for the weight loss include first, which is gastric balloon. Now gastric balloon is something which is an inflatable balloon which is placed inside our food bag, which is called a stomach. This balloon is inflated with the help of an endoscopy, or it can be placed on OPD basis, which is called as Allurion swallowable pill balloon.
Okay.
Now these balloons give us a sense of fullness, and when we get sense of fullness, we tend to eat less, and simultaneously if we work on diet and exercise, we tend to lose weight. Usual weight loss which we have seen with gastric balloon is in the tune of 15 to 20 kgs. This is directly proportional to the amount of excess weight we have.
Okay.
But if you see, good amount of patients have excess weight in the range of around 20-25 kgs. If you see the population as a whole, maximum number of patients are in this excess weight range.
20 to 25 kgs.
Yes.
Okay.
So balloon definitely helps. The challenge is that balloon is not a permanent solution. We will, if it's an endoscopic balloon, we will have to remove the balloon. If it's a swallow pill balloon, it will get passed through the motions. What after that? Because this will remain with us for 6 months to 1 year. Again comes consistency.
Okay.
Whatever we have built with the balloon, we will have to stick to or adhere to it for all our life. Balloon is an probably additional engine which we are putting to our train to push through the slope or heavy terrain. But once we reach, we will have to stick to the lifestyle modifications which have been generated by the help of balloon. This is the first method. The other two methods which are performed under anesthesia and with the help of either minimal access or robotic surgery. Here we do some modifications on our food bag, which is called a stomach. Either the size of the stomach is reduced or a part of stomach is also bypassed and connected to the distal part of a small bowel.
Okay.
So people tend to ask us, if you are reducing the size of our food bag, we might as well just eat less. Why do a surgery?
Yeah.
But the answer is that this surgery doesn't reduce only the intake, it brings hormonal changes in our body. And we have serially seen our patients that post this surgery, the metabolic rate of the individuals increase.
Okay.
And because of those hormonal changes and metabolic rate, we get weight loss. Not only
It's a
weight
combination.
Yes, not only weight loss. One of the biggest justification of hormonal effects of this surgery is that those patients who are diabetic before surgery, who are obese, who have excess weight and diabetes, their sugars come to normal immediately next day after the surgery.
Oh wow, just the next day.
Yes,
okay.
that's the kind of miraculous results we get. And that proves the hypothesis that this surgery is not only calorie restriction. This surgery is something beyond calorie restriction and creates hormonal effects which are called as ghrelin effects or GLP analog effects. And we have now a lot of drugs which are coming in our market which have those GLP analogs and which are going to be used in the journey of weight loss.
Okay. So this surgery is called bariatric surgery,
Correct.
right?
Correct.
You said there's two types.
Yes,
So,
sleeve gastrectomy and gastric bypass.
okay, can you explain the difference?
So sleeve is something where we reduce the size of the stomach and remove the excess part of the stomach from our body permanently. While in gastric bypass, we reduce the size of the stomach, disconnect the rest of the part of our food bag, which is stomach, and connect the distal part of the small bowel to this new pouch.
Okay.
Thereby, we are bypassing the proximal 100 to 150 centimeter of our small bowel. So, since we are bypassing this proximal part of our digestive system, this is called as bypass.
Okay.
And since we are creating a small sleeve of our food pouch, this surgery is called as a sleeve. So, these are the two surgeries which are commonly performed.
Okay. So you just, how do you determine what depends on the patient needs?
Which surgery for which
Yeah,
patient?
yeah.
Okay. So, there are a lot of criteria. We have to take a detailed history and try and understand what kind of patient we are coming across, what's the cause of weight gain in this patient, what is the age of this patient, what are the associated disease conditions with this patient. Now, some patients are volume eaters. Like we have patients who used to eat 4 to 6 vada pavs at a time. Now, they are classically volume eaters. Now, in these kind of patients, restriction works stronger. While some patients who have metabolic challenge, and if we ask them, they say my portion is not that big. Despite of me having a low portion, I gain weight.
Okay. So it depends on your metabolism.
Yes.
Okay.
So based on their metabolism, based on their physiology, based on their age, based on their associated comorbidities, the decision of sleeve versus bypass is decided.
I understand. Okay, that's interesting. And the balloon, when do you determine who needs the balloon?
So given a choice in every weight loss consultation, first preference is always to encourage people to follow diet and exercise.
Right.
Because whatever we do, diet and exercise are part and parcel of their lifestyle. It is not so, let me tell you very clearly that if I undergo bariatric surgery, diet and exercise is an excuse for me. This is not true. Diet and exercise remain the cornerstone of our life, irrespective of whether you treat any weight loss method or you do not. So, balloon is usually used in patients who want a motivation of following a diet and lifestyle consistently, because the challenge there is, despite their efforts, what they lose is around 2 to 5 kgs. And that is happening basically because there is an element of issue related to adherence, there is an element of issue related to the metabolic diseases which we discussed like hypothyroid or PCOD. And we find very good results with balloon, especially in the younger population, because their inherent metabolic rate is always on the higher side.
So the balloon doesn't change your hormones?
No.
It won't? Okay.
No.
So that's the difference.
Correct.
Okay. And yeah, if you're younger, you don't. You
Yes.
already have a higher rate.
Yes, correct.
Generally.
Absolutely.
Okay. Okay. Now I understood. Now going to non-invasive, non-surgical options. I know I know it's not come to India. It will pretty soon. But all these medications that are happening, Ozempic and Mounjaro, and all the drugs people are taking. Can you tell us a little bit about that? What do you think? When do you think it'll come to India? And
I think they are coming to India by 2025, maybe
Okay.
by Jan 2025.
Oh, okay.
And it's a very good news for the simple reason that probably each one doesn't need surgery. What we have to understand is, again, I will like to quote my father. My father used to say that every medicine which we consume is ultimately a chemical. So whatever medicine we are taking, for whatever kind of illness we are taking, we are consuming a chemical. So if we are consuming any kind of chemical, it has to be always under the supervision of somebody who is an expert.
Yes.
And if we do not do that, there is always a possibility of we harming ourselves. So these medications are definitely a boon when it comes to weight loss. It's an interesting story. These medications were found to be effective first for the sugar control.
Right, diabetes, yeah.
And when they were seeing patients of diabetes losing weight along with their sugar control, they realized that these medications can be used also for weight loss. So that's an interesting finding. But we have to understand that don't leave your control to something else. If we
Don't depend on it.
Yes, if we leave our control to medications, we are doomed to fail. Because there are some challenges which are associated with these medications, the way any medications can have. We all know that any allopathic medication which we consume always has some side effects which are written in the disclaimer. The same is true with these medications. So we will have to really use them judiciously, effectively, in the right people and at right time. So it's a good thing to have, but it's a double-edged sword.
Yeah, it can be abused, right? So, for example, I don't mean to keep on bringing up these examples in the U.S., but the zip code they found that takes the most Ozempic was the Upper East Side of New York City, which is the most. I mean, everyone there is pretty fit. If you go there, they don't really need Ozempic, but I think that pressure of being a certain look has made them take it. So will that happen here? It will, to some extent it will. So they would come to a gastroenterologist to get these medicines, or how does it work?
Usually the prescriptions for these medications can come from gastroenterologists, they can come from endocrinologists, they can come from bariatric surgeons, they can come from physicians who treat diabetes. So we will have to, because the use of this drug is at multiple levels and for multiple purposes. Yes, weight loss can be a side effect of this. I am little concerned about India because India is not greatly regulated
Yes.
country, and that's where there is always a possibility of misuse of these medications. Mind you, there are significant side effects of these medications also, like acute pancreatitis and inflammation of gallbladder, which is called as acute cholecystitis.
Okay.
So it is not so easy pill, and trust me, there is no easy pill in this world.
Yeah.
Whatever you do, whatever you follow, diet and exercise will remain a cornerstone.
Right. So you said gallbladder. What are the side effects? The main pancreatitis.
Inflammation of the pancreas. Pancreatitis is very dreadful.
Yeah,
we
it's very bad.
We recently had a news also that one of the patient who was consuming Mounjaro or Ozempic had acute pancreatitis. Again, some celebrity.
They had it before, or they got it because of the medicine?
They got it because of the medication,
Okay.
and they lost their life.
Yeah.
So this is a recent news which had flashed. Although I don't want to threaten
Yeah.
anybody, but these are the realities.
Yeah.
It's quite common to have gallstones after consumption of these medications, because basically these medications reduce the ability of our bowel to push the food ahead. So they give a kind of sense of fullness, and that also leads to stagnancy in our gallbladder and increased incidence of gallstones. So the number of surgeries for gallbladder stones have increased after consumption of these medications. In fact, in my practice, I have realized that number of gallstone incidence has even otherwise increased, and this is probably because of the extremes of diet people are following.
Oh, that's interesting. Yeah.
Because one of the trigger for formation of gallstones is prolonged fasting for prolonged duration. So those people who follow extremes of diet like keto diet or excessive fasting suddenly have a tendency to develop gallstones and gallstone related problems.
Okay, there's no escape with this. So it's probably better to go on Ozempic than these fad diets. What do you think? If you need to, if you're like, if you are that weight. I mean, some people are not overweight and they're still doing these extreme diets to look that size 0 or something.
But even Ozempic causes gallstones, because Ozempic causes cholestasis and Ozempic causes increased incidence of gallstones. So there is no easy...
There's no easy route. And you just have to be very careful when you're taking it, right?
Very.
Okay. So somebody like, for example, me, like maybe 20 kgs overweight, above the regular, medical weight that you should be. And I'm tried everything, and I come to you and I say, I've tried everything, put me on Ozempic or on Mounjaro. What do you suggest? What would you suggest?
Frankly speaking, we will have to go through the complete history and try and understand the trigger. Now, if in a similar case like you, if the trigger is stress, Ozempic and Mounjaro is not going to help. We will have to treat the stress. It's like we know the cause is something different and we are treating problem which is something different. So in weight loss, we have to understand that gaining weight is a physiological phenomenon. All of us can see our photographs when we got married or when we were of 18. And if we see our photographs of today's, we definitely have gain some kgs for sure.
It's natural.
Yes. So we have to understand that for women, gaining weight in pregnancy is natural. What you do after you gain weight is something which is crucial or critical. For men, gaining weight as they progress in their age is natural. What you do to maintain your weight is crucial. And probably all of us will have to focus on trying to be proactive in maintaining our weight of 1 to 5 kgs around our ideal weight than getting aware about these things when we are 20-25 kgs excess.
Right.
And then what's the point in earning when you are going to spend all on losing weight?
Yeah.
Doesn't make sense.
I know, you spend all these years working and then you have to spend all the years in the hospital or getting investigations. So just for a young person, keep that in mind.
Absolutely.
Have a balance, right? Before someone goes into surgery or takes these pills, what kind of, do they need psychological support? Do they need, what do you suggest that they,
Definitely. All these individuals who have some weight related issue, we have found that stress at a subconscious level is part and parcel of the personality. So we have tendency to overeat when we are emotionally upset or depressed. We have a tendency to overeat when we are joyous or excited. We have a tendency to overeat or we feel hungry if we are remaining awake at night. So any situation which leads to some kind of stress in our body basically releases cortisol, which is a stress hormone, and cortisol in one word is called as flight and fright response. So cortisol is basically increases our appetite because it needs more and more energy to sustain the stress. So probably that's where meditation has a significant role. How we play the cortisol game and maintain our cortisol even in highly stressed situations is very, very vital. And that's how role of psychologists from say allopathic perspective or role of alternative therapies to maintain our tranquility is of very, very importance.
Yeah. Yoga is, I mean, they've done numerous studies on yoga, asanas, as well as meditation, how it brings down the cortisol. So everybody should have that in their
No doubt.
repertoire.
Strongly recommended.
So after the surgeries, from what you have seen, somebody's like 3 years out of bariatric surgery. Do they gain weight, or how does the weight come back on? I mean, some weight will come back on, but overall, it's worked out well for people.
I would not make a generalization. There is a caveat which we tell to every patient who undergoes bariatric surgery, and we don't want them to exclusively rely on surgery. Otherwise, people have a myth. They feel that now that I have done bariatric surgery, I can do anything in my life and I will be happy. That's not true. We have to understand that diet and exercise form a cornerstone of bariatric surgery. Even if we have undergone bariatric surgery, correct diet, regular exercise are necessary, and if you really want to avoid bariatric surgery, might as well follow up front. If you follow diet and exercise, and if you maintain your weight around ideal weight, I am not saying exactly at ideal weight, around ideal weight, that should be more than enough. The issue is that we tend to awaken ourselves when we are high in our ideal weight by 50 and 70 kgs, and then it is an irreversible game.
So out of the 10 patients who have bariatric surgery, how many find it successful long term out of the 10, for example?
So I would probably agree with you, because we do a complete psychological screening of this.
You mentioned you have a support group,
correct,
right? Yeah.
Correct. So we do a complete psychological screening of these patients to understand what is the trigger in these patients. We work on them. We have a psychologist in our team who works with these patients to maintain their stress levels to a particular level. As we discuss support group, we encourage them to meet very regularly and discuss their challenges, whatever they are facing. And people are really innovative. We get to know so many new things coming from them and how they have been coping up with their new life. But the biggest change which happens to them, if you ask me, is not resolution of their comorbidities, but increase in their self-esteem.
Right.
Understanding yourself, seeing at yourself as a confident personality is something which is so rewarding for yourself. So probably mind again plays a significant role than the resolution of comorbidities.
Yes. So just for our audience, I didn't say this, but one of the reasons you need to reduce your weight is for all these comorbidities. I mean, extra weight causes a host of diabetes and heart conditions and joint pains, lots. So that's one of the reasons. It's not just to look good, but that is the self-esteem part. That when you feel good about yourself, everything else shows. Even all the psychologically, the comorbidities have a lot to do with your psyche, like you said. So that also plays a big role.
And it is unfortunate that people do joint replacement surgery, but their weight is 120 kgs.
Oh.
And then you are not understanding that the problem you have land up with joint replacement surgery at the age of 50 is because your weight is more, not your joints have issues. So you are trying to treat the results, but not the cause. I come across so many patients who have so many weight related issues. There are 28 different illnesses whose root cause is obesity.
Yeah.
So if we treat obesity is the mother of all these. If you start from top to bottom, obstructive sleep apnea, which is very common, snoring for that matter, is very common in obese people, and the cause of this is obesity. Reflux acidity, its cause is obesity. Fatty liver, ischemic heart disease, gallstones, polycystic ovarian disease, varicose veins, knee pain, backache, hypothyroidism, and the list goes on.
There's probably a stigma associated with a bariatric surgery, whereas a knee replacement, everyone does it. Bariatric surgery means that you're fat. Is that what you find?
More than that, I feel there are a lot of misconceptions in community. People feel that if it's a surgery, it will be a big cut to their body. Also, a couple of years before, bariatric surgery was not covered under insurance. So it was out of pocket expenses for every individual or every citizen of this country. At least now in couple of years it is getting covered in insurance, so that burden has gone down. There is good amount of awareness which is happening, but I still feel there is huge amount of population who doesn't know what exactly bariatric surgery is. There is a huge amount of medical community who doesn't know what bariatric surgery is. I get some references where they say that you get a liposuction done for my patient because he is 140 kgs, and then I feel no, this is not same.
Liposuction is just taking out the fat, right?
Correct.
Yeah.
And it's just taking out the fat from the skin below.
Right.
It's a cosmetic surgery. While bariatric surgery is no way a cosmetic surgery. Bariatric surgery is a metabolic surgery which makes people healthy. It changes their life for good. So I think here is a huge potential, and that's why people who do these kind of activities, I'm sure is going to definitely help a lot of people to understand what it is and how it should be done.
Yes. So I just want to point out that, like for example, angioplasties and heart surgeries were like taboo back at once. It was like a big thing. Now it's a very common procedure. So I think we're headed toward this because it is the need of the hour. I mean, obesity is a huge problem. What about child obesity? What age can you get these surgeries?
Very vital question. Probably, I think the most important question we should discuss in this podcast, because I am worried about our future generation.
Yes.
I see a decreasing trend of physical activity in the younger population. I recently had a discussion with one of my family friend who stays in Mumbai, and he said to me that now the IIT, JEE, EEE preparation has started from 6th standard. So obviously kids are going to compensate or compromise on what? Their physical activity. And if we are going to compromise on your exercise and physical activity, one of my fitness friend told me that when he was working with children in COVID times, he told me that even 6-8-year children have lost their hand-eye coordination. When they were playing a throw ball, they used to get lost in the air, not able to catch because of lack of physical activity. And the biggest thing human body can have is something called as muscle memory. So if we have done some kind of exercise in our childhood, it is very easy for us to reactivate those muscles at a later half of our life. And what do we see in today's practice? Almost 80% of women who come to us for weight loss consultation, and in the history if we ask, was there any physical activity in your childhood? The answer is plain simple no.
No, it's...
So we have to work on increasing muscle memory and exercise in our younger population. The easy, carbohydrate rich, highly processed food which is so rampant and available in fridge and society is destroying the future of this country, and it's a burning issue which we are going to face. We see younger population like 20-25 getting affected by diabetes and heart disease. When have you heard people of 40 getting affected with diabetes and heart disease 10 years before? And this is all purely lack of physical activity and wrong diet which is practiced.
Yeah, I've been trying to talk about this for many, many years. And like you said, it was not always the patient's fault. It's his hormones or other issues. It's also, the food companies.
True.
They are pushing food. A lot of awareness has to be taught to even kids, especially kids. Advertisements and incentives to eat, incentives to buy this, and makes it look, sexy to have orange juice and pancakes, and all these things are being sold to you. In addition to advertising, all the food is highly addictive. A combination of fat, salt, and sugar makes the food addictive.
True.
And we don't realize that. So a lot of awareness has to be put into this. So, but this has been a fantastic conversation. We could talk a lot more on this, but it is the future, and I would like more people to know about it. DrNeerajRayate.com is where you can find him, and it has a lot of information about obesity and bariatric surgery. He can be found in Jupiter Hospital here in Pune. And I want to thank you for all the wisdom that you have given us. It's just the tip of the iceberg, people. So, reach out to him and read up on what the possibilities of, the importance of keeping a healthy weight. And thank you for listening. Thank you, Dr. Rayate.
Pleasure is mine.